Hi friends, welcome back to Complete Medical Coding. Today let's discuss few more questions from the Musculoskeletal series, the 20,000 series. Okay, so if you are new to the channel, please subscribe and let's look into the questions one by one. So moving to the first question, a 46-year-old female has a mass growing on her right flank for several years. It has finally got significantly larger. She is brought to the operating room for definitive excision. An incision was made directly overlying the mass. The mass was down into the subcutaneous tissue and the surgeon encountered a well-encapsulated lipoma approximately 4 centimeters. This was excised primarily bluntly with a few attachments divided with electrocautery. What CPT code should be reported? So here you have to code for the excision. Excision is the procedure carried out here, right? Excision of a tumor, because this is a mass growing on her right flank, on the patient's right flank. So you have to code for the excision procedure, excision of tumor. Okay, and what is the size? 4 centimeters. 4 centimeter. Okay, let's move to the options. What is 21925? Go to 21925 CPT code book. 21925 is biopsy soft tissue of back or flank deep. This is not biopsy, but this is excision. So biopsy is not the answer. What is 21931, 932, 935? 21931, 932, 935. 21931 is excision of tumor, soft tissue of back or flank, subcutaneous, 3 cm or greater. Yes, this is subcutaneous. What is 21932? Excision tumor, soft tissue of back or flank, subfacial. Example, intramuscular, 5 cm. Sorry, less than 5 cm. And 21935 is radical resection of tumor less than 5 centimeter. No, this is excision of tumor subcutaneous, because in the question it is mentioned the mass was down into the subcutaneous tissue. So this is excision of tumor subcutaneous. So the answer is option B, 21931. Okay, excision of tumor, soft tissue of back or flank, subcutaneous, 3 centimeter or greater. Now second question. A 32-year-old patient complains of chronic arm pain and shoulder pain following bilateral carpal tunnel surgery. Patient is under follow-ups by pain management for over a year. Physician finally diagnoses the patient with RSD, that is reflex dystrophy syndrome. Okay, RSD means reflex dystrophy syndrome. Physician performs 6 trigger point injections into 4 muscle groups. What is the CPT code for the procedure? So here you have to code for the 6 trigger point injection in 4 muscle groups. Okay, so you have to code for the injection, trigger point injection. So let's directly move to the options one by one. What is 20552? See, here you have to code for the 6 injection. So what is 20552? 20552 is injection single or multiple trigger points, 1 or 2 muscles. You need 4 muscle groups, right? 6 trigger injections in 4 muscle groups, not 1 or 2 muscles. So that is wrong option, wrong CPT code. 20552 is wrong. What is 20610 in option C? Option B also it is same, 20552 times 5, but that is wrong. What is 20610? Arthrocentesis, aspiration or injection, major joint or bursa. No, this is trigger point injection, not arthrocentesis. So that's also wrong. So what is option D? 20553? 20553 is injection single or multiple trigger points, 3 or more muscles. Yes, 4 muscles we need. So 3 or more muscles. That is a correct code. So answer will be option D, 20553. Injection single or multiple trigger points, 3 or more muscles. Okay, you don't have to code it again or multiple it again times 4 or 3. No, nothing. Because it's in that CPT code itself, 20553. In that code itself, in the description, it is clear that single or multiple trigger points. Single or multiple trigger points. So here we have 6 trigger points. It means multiple, right? And then 3 or more muscles. So 4 muscle groups is also coming under this description. So 20553 is the answer. Okay. Now, third question. A 38-year-old male presents in the operating room with de Quervain's disease of right hand. With sterile approach to the right wrist, an incision was made dissecting down to the tendon sheath. The tendon sheath is incised, releasing the contracture that has been causing pressure on extensor tendon. Incisions are repaired in layers. What CPT and ICD-10 codes are reported? So here, what is the diagnosis? Diagnosis is de Quervain's disease. Okay, so this is a simple question. You can easily find the answer because de Quervain's disease is the diagnosis. You need to find out the diagnosis first. And what is the procedure here? Tendon sheath, incision. Okay, incision of tendon sheath. Anyway, let's first find out the ICD code. Okay, only two ICD codes are in the options, M65.4 and E34.51. What is M65.4? M65.4 is radial styloid tenosynovitis. In bracket it is mentioned de Quervain. So in the question it is de Quervain. In our diagnosis de Quervain. So radial, that's another name, radial styloid tenosynovitis. Okay, so that is a correct ICD code, M65.4. If you want, you can just check E34.51 also, which means complete androgen insensitivity syndrome. No, that's wrong. Our diagnosis is de Quervain, which is M65.4, radial styloid tenosynovitis. So this M65.4 is in options A and C. So you just have to look into options A and C. To find the CPT codes, you can just go to the options A and C, which is 25000 and 25001. So that you need to find out which is the correct CPT code. So first one, 25000. What is 25000? Incision, extensor tendon sheath, wrist. Go to 25000 in CPT code book. Incision, extensor tendon sheath, wrist. Example, de Quervain's disease. Yes, this is de Quervain's. And where is the incision done? Incision was made on the tendon sheath. Yes, tendon sheath of the wrist. Extensor tendon, that is also mentioned in the question. The tendon sheath is incised, releasing the contracture that has been causing pressure on extensor tendon. So, extensor tendon incision on the wrist, and this is on the right hand, so you have to append it with the modifier RT. If you want, you can just take 25001. 25000, what is code 25001? Incision, flexor tendon sheath, flexor tendon sheath, wrist, example, flexor carpi radialis. Now, this is another diagnosis, flexor carpi radialis. So, our diagnosis de Quervain's. So, the correct CPT code is 25000. Okay. So, the answer will be option A, 25000 with RT modifier and diagnosis M65.4. Okay. Now, fourth question. A 46-year-old with chronic left trochanteric bursitis is scheduled to receive an injection in the clinic. Under ultrasound guidance, a 22 gauge spinal needle is introduced into the trochanteric bursa and total volume of HCG of normal saline was injected. What CPT codes are reported? Okay, so here the procedure is, what is the procedure? Injection. Yeah, injection into the left trochanteric with ultrasound guidance. So let's move to the options. What is 20611? We have only three, 20611, 20610, 20552. And then 76942 for the ultrasound guidance. Let's look into those codes. What is 20611? Before that, there is 20610, right? Arthrocentesis, aspiration or injection, major joint or bursa. Example, shoulder, hip, knee, subacromial bursa. This is what we need exactly, okay? Without ultrasound guidance. So, 20610 is without ultrasound guidance. So, if you go to option C, 20610, description is right, but in that description a slight change is there. It is without ultrasound guidance. So, they have mentioned the ultrasound CPT code 76942. Okay. Anyway, just hold it on. Let's move to the other CPT code 20611. Same arthrocentesis, aspiration or injection, major joint. Yes, this is arthrocentesis. Okay, major joint or bursa. Example, shoulder, hip, knee. Here where it is given spinal needle, shoulder, hip, knee, and subacromial bursa. Yes, bursitis, shoulder bursitis. So 20611 is with ultrasound guidance, with permanent recording and reporting. So 20611 CPT code is with ultrasound guidance, as per injection with ultrasound guidance. So if there is any exact CPT code, you have to always, like if there is any combination code, you have to always use that code. Don't go for 20610 along with ultrasound code. You have to, anyway 20610 is wrong because in the description it is without ultrasound guidance. So you can't use it that. Okay, and then again adding ultrasound code, no, that is wrong. We already have a correct CPT code with the exact, the combined code, like with ultrasound guidance code. So you have to use that one. So the correct answer is option B, 20611 with modifier LT, because here the procedure is carried out on the left side. So LT is the procedure, I mean modifier. Okay. Now moving to the fifth question. Dr. Kim completed a therapeutic manipulation of the temporomandibular joint. An anesthesiologist placed this healthy 57-year-old patient under general anesthesia and monitored him during the procedure. The intra-service time was noted as 1 hour. The patient tolerated the procedure well and was returned to the recovery room in good condition. How would Dr. Kim's services be reported? So what is the procedure for Dr. Kim's services? What is the procedure? The manipulation of temporomandibular mandibular joint. Therapeutic manipulation of temporomandibular joint. That is the procedure. Okay, and the patient is a healthy. Procedure was carried out under general anesthesia. The service time was noted as 1 hour. Okay, so let's move to the options. Let's find out the CPT code first. So what is 21073? The first CPT code 21073. Go to 21073, which means manipulation of temporomandibular joint. You may get short form also as TMG, temporomandibular joint. Okay, TMG. Sorry, TMJ. So manipulation of temporomandibular joint, therapeutic. Yes, this is what we need. Therapeutic manipulation of temporomandibular joint. Requiring an anesthesia service, that is general or monitored anesthesia care. So here in the bracket itself it is mentioned under general anesthesia. It can be a general anesthesia or a monitored anesthesia care. So whatever description given in the question, like general anesthesia and monitored him during the service, and that monitoring time was 1 hour, everything is mentioned. That is only to make you confused. But in the CPT code 21073, all these description are included. So you don't have to go for the other monitored care service, the other codes which is mentioned in option A, 99156, 99157, all those is not required because it is already given in the, it is already mentioned in the CPT code 21073 description, right? So you don't have to code it separately. So you got the answer, right? You got the answer as option C, 21073. 21073 is there in options A and C, but in option A there are anesthesia additional codes for anesthesia. This 99156, 157, all these are additional anesthesia codes. Like, I mean, not anesthesia, monitoring code, monitor, what is that? Monitored, additional monitor care service, which is not required. So 21073 is the answer. So answer will be option C, 21073. In that itself, the monitored anesthesia care description is mentioned. So you don't have to code separately for monitored anesthesia care. Okay. So the answer is option C. So friends, these are few important questions from musculoskeletal series. I'll come back with more questions from the remaining series. So stay tuned for more videos. If you like this video, please like and share. It will be helpful for few, at least for few people, few students, those who are preparing for the examination. So thank you so much friends for all your support and stay tuned for more videos. If you are new, please subscribe. Thank you. Bye. Take care.